this is actually the hip, and I'm going to skip this because I want to show you certain signs and symptoms. So if naka-notice ka na nagtakiang na si nanay or si tatay, and then kalit lang ni siya or hinay-hinay, nagkalisod ang ilang paglakaw, magtakian sila, this can be a sign of many things. Arthritis is one of those things. That is why if naamoy oras and you may think that nag-worsen siya, come and see us at the Cebu Orthopedic Institute so that we can check kung unsa gyud nahitabo. Most of these patients, pwede ra na nothing serious. We just need to check and examine before we get any x-rays. So examino na mo ang pasyente before any x-rays, tanaw na mo kung nabay na usab sa ilang mga bukog. This is showing you na pwede na i-limblet discrepancy, so mas taas ang usa ka tiil compared sa pikas, and that can happen from time or from injury, or even it can be natural na dugay na ni na kaning pagkabata pa ubog gyud. That can be also a sign of osteoarthritis. It can be many things. There can be patients na dili na malihok kayo ang joints, such as a flexion contracture, kay nigahi na ang muscles. That can be a sign of arthritis, as well as some other things as well. So that's why we really do need to, number one, examine our patients, talk to them, and get an x-ray probably in these cases to be able to get a correct diagnosis para makabaw gitawon sa problem. Because I've been talking a little bit about x-rays, this is an x-ray of the hips, of the pelvis, which is standing. Klaro kayo na very round and nice ang joint. You also note that there is a joint space in between the ball and the socket. And here, you can see na wala na space. So there's no more space, and that is already bone on bone. That can be severe osteoarthritis already on the left, and avascular necrosis and OA on the right. So this is the AVN, or osteonecrosis with osteoarthritis happening. That's the secondary type. So tungod na ay problem ang head, it became arthritic, it's painful compared to the normal. This is osteoarthritis also on the left, but this time walay osteonecrosis. So this can be a primary osteoarthritis. So in osteoarthritis, there's narrowing of the joint space, what na space. There's bone on bone, you have spur formation or kanang mga height. So there are pointy things that we see on the x-ray, and the deformed na bones. That's a ball and socket problem, and because it is a ball and socket problem, it can be treated, number one, with weight loss and exercise. We don't really try medications or surgery right away. We try to treat our patients, number one, with weight loss and exercise. We want to educate you. We want to give you the medicines and sometimes a certain maintenance, like with paracetamol, and really injections and supplements before we give the surgery, which is actually a joint replacement. Okay, so this is something that we also do for hip fractures, but let's talk about the other hip problem, which is hip fractures.